Great. Thank you, Erin. Good morning, everyone. Just as a little bit of introduction, I was, prior to coming to Blue Cross Blue Shield, I was an FBI agent, 25 years, and I had the privilege of doing some training in Asia. So although I've never been to Indonesia, I've known your part of the world. I've been to Mindanao training, Hong Kong, Manila, Taipei, and Dhaka in Bangladesh. So I appreciate your culture, and we are so gratified for this invitation this evening. I was also raised in a medical family, and I see a lot of you are physicians that are attending to this morning. And the culture that I was raised in, and I'm in my 50s, so I've come from the baby boomer culture. Doctors in our culture, in my life as a baby boomer, were believed to be like gods. So it's very difficult for us to even assume that doctors would ever commit fraud, because they're healers and they do the right thing. But there's a changing culture. There's a culture of greed out there, and we are trying our best to fight a lot of the healthcare fraud that's out there. So who are the perpetrators of fraud? They're the physicians, they're the hospitals, they're the manufacturers of durable medical equipment, of pharmaceuticals, specialty pharmaceuticals, wheelchairs, walkers, you name it, and the pharmacies are also committing a lot of fraud. Erin, are they moving our slides for us, or are we?
I did it for you.
Oh, thank you.
You're welcome.
So who actually perpetrates the fraud? Let's talk about the patients. We have a problem in the United States right now where there are some dishonest patients that actually collude with the doctors to create false claims. So, for example, if an individual is addicted to opiates, they may collude with their prescriber to get more opiates or more pharmaceuticals that are the class 2 and 3 drugs, the Oxycontin and the hydrocodone. They may collude with the doctor to get him to prescribe more drugs than they need so that they could sell them on the street. They're very valuable on the street. One Oxycontin pill that's 80 milligrams is worth $1 a milligram. So we have a huge burgeoning problem in the United States with a lot of our youth using these opiates, becoming addicted because it's synthetic heroin, and they begin colluding with dishonest doctors who get kickbacks to get them addicted and to continually prescribe these drugs. There's other patients that seek medical care that's not covered or needed. In this example, it would be cosmetic procedures. Everybody wants to look young and beautiful and have cosmetic surgery, and we as commercial payers, commercial insurers, do not cover cosmetic treatments. So oftentimes our members will go in and they'll tell the doctor that they want a tummy tuck or a nose job, and can the doctor find a way to get that covered by insurance? So oftentimes what we see is members colluding with their doctors to get a tummy tuck, but the doctor bills it as a hernia repair. Or they will get a rhinoplasty and the doctor will bill it as a septoplasty so that they can get your cosmetic treatment covered. We also have a lot of card sharing where a lot of our members, or some of our members, are loaning their medical identifications to others so that they can get services covered. And we see a lot of this with siblings. I've had cases where one brother is insured, the other brother does not have insurance. The uninsured brother has an appendicitis attack. He needs to go to the hospital to have his appendix removed. He knows it's going to be very costly, so he borrows his brother's insurance to get it covered. And because the brothers look similar, and he's also borrowing his brother's driver's license with his picture, he gets in and he gets it covered. This is called card sharing or medical identity sharing. And finally, as I spoke before, they also are seeking prescription drugs for resale on the street. Next slide, please, Erin. And everybody feel free to ask questions as we go along. A lot of fraud in the United States now deals with or is perpetrated by organized crime. Because healthcare fraud is a white-collar crime, which means it's perpetrated in an office. The view of this type of crime is that it's victimless because it's just a monetary loss. A lot of our organized crime criminals have turned from drug dealing and syndicated organized crime to healthcare fraud. They do this because the penalties are lower and because they may never get caught. And third, because if they get caught, they're just often asked to pay the money back without having to go through an indictment, conviction, and sentence in prison. So some of the organized crime things that we're seeing is they steal a provider and a patient's identification to bill for services that are never delivered. They stage false traffic accidents so that they can get a medical payoff, and they're really not injured. They just make it look like it's a traffic accident. They create false front offices or phantom clinics, and they bill for service never delivered. And in a few minutes I'll talk about that, because right now I'm in Miami investigating over 100 phantom provider offices that are nothing more than storefronts. They do not exist, but they have been billing us for services never delivered. Another thing that we see with our members is the performance of harmful procedures on patients out of greed. I have had criminal cases in Atlanta where doctors in the area of oncology advertise that they can cure your cancer with experimental and investigational type of procedures. They offer their services. They promise these sometimes stage 4 cancer patients that they will save them, and they bill just extraordinary amounts of money out of greed in the promise of saving cancer patients, and all the while they're performing experimental procedures. We have actually convicted a number of these doctors in court for a lot of this greed. Oftentimes we see that they will bill Blue Cross Blue Shield for conventional chemotherapy when in fact they're infusing the member with a type of experimental drug. One that stands out to me is a doctor that was actually infusing the patients with a weed killer. His explanation in the courtroom was it contained the same amount of toxins as a chemo drug had. So he's currently in prison right now. And then the last type of organized crime is that they steal pharmaceuticals for illegal sale in other countries. This is common. They overbill for particular specialty pharmaceuticals that are very expensive, and then they put them on the market in other countries to make a good margin of profit. Examples of this are some of the very expensive factor blood pharmaceuticals for our factor 8 patients.
Okay, I'll take over here for a little bit. In the U.S., we have 3 buckets of how we define sort of fraud, overall wasteful behaviors. We call it fraud, waste, and abuse. And the deciding line between the difference is the intent. Fraud requires an intent. It's an intentional deception. And that the deception has to result in some sort of unauthorized benefit, whether it be financial or otherwise, to either that person or, as Alanna explained in some of these kickback situations, or another person. We look at waste as overutilization of services. So unnecessary costs, things that are mistakes that happen, we would consider that waste. We don't consider that criminally negligent actions, but just more of a misuse of resources. And then we have abuse. And abuse can be, fraud and abuse can intersect, but we are specifically looking for intent in fraud. Abuse includes actions that can directly or indirectly result in improper payments or payments for service that fail to meet certain professional standards. Fraud and abuse, the intersection, it depends on the facts and the circumstances and the intent, and then, as I'll talk in the laws, prior knowledge becomes an important defining line whether someone's being fraudulent or whether their actions are abusive. At this point, I'm going to turn it over to Alanna, who's going to describe to you in the U.S. how we define different types of healthcare fraud.
Okay, thanks, Erin. So there's several types of fraud that we identify in healthcare. One of the biggest ones is billing for services that were never rendered. They either use the patient information that they get through identity theft or just through their office services, and they fabricate entire claims, or if a patient comes in for a simple service, they'll pad the claims with charges that did not take place. This is pretty common. What we see is, here's an example, a New York dermatologist paid kickbacks in the form of medically unnecessary prescriptions for drugs, the controlled substances, to induce the beneficiaries to continue to come to his office. So, for example, if he knew someone was addicted to opiates or any type of drug, he would tell them that if you come back every month, I'll give you another prescription. He would then bill the federal or private health plans for the visit and for additional services not rendered. This particular dermatologist filed almost 2,000 claims for surgeries performed on one patient, which ultimately resulted in him receiving almost $500,000 in reimbursements. So that's an example of billing for services not rendered. And when they submit these claims, they are certifying that among other procedures, as you know, dermatologists often do surgical procedures looking at moles and different skin lesions, but he actually certified that he did 1,300 4-centimeter incisions on one patient's face. And I don't think there's any face out there that's large enough for that many procedures. So he wasn't even being logical in his fraud fact pattern. Ultimately, his participation in the scheme proved fatal as his patient overdosed on the prescription drug which he had regularly prescribed for his patient. So this one is a very sad story. It involves fraud, abuse, and greed. All right, next slide, Erin. Thanks. This is one of our biggest issues, and I'm not certain in Indonesia if you follow the American Medical Association CPT and HCPCS and ICD-9 and 10 codes, but one type of fraud that we really have issues with is upcoding. This is where the providers bill for a more complex, higher priced service or procedure than they actually performed. They actually inflate the diagnosis code to get a more serious condition on paper, when in fact it is not that high level of acuity or developed serious condition. What we have this problem with is office visits and evaluation and management codes. Erin, if you turn to the next slide, I'll give some examples. So physicians here in the United States perform and bill for hundreds of patient exams a year using evaluation and management codes. There's a number of different codes they can use, and they're all based on the complexity of the evaluation performed. The extent of the physical examination performed by a physician for a patient with a sore on the lip would be focused and billed at a very low rate. A complex condition would be if somebody came in, let's say a 30-year-old patient with a 3-month history of fatigue, weight loss, intermittent fever, enlarged spleen, multiple comorbidities, which would lead to a more complex examination. And that would be billed at a higher rate. And it would take longer. It would take maybe an hour to go through all of the comorbidities versus the individual with a cold sore that maybe take 10 minutes. So the upcoding occurs when a dishonest physician bills at a level that's above what he actually performed. I will give you a personal example of this. I went to my dermatologist last week because I had had a rash on my arm. I had the rash in May. He gave me some topical type of medicine for it, and he wanted to recheck it in July. I went in. I was there for 5 minutes. He looked at it and it was fine, and he handed me the bill, and I noticed that he billed a level 4 exam. The levels of our evaluation and management go from 1 to 5, 1 being the least complex, 5 being the most complex. He billed for a level 4, and I had no other issues at all. So I went back to the office and I said, I'm going to have to open a case on my doctor now because I have to see how often he is upcoding on every member that comes in. And it makes a lot of difference because if you bill at a level 2 or 3, maybe you will get $50. But if you move it up to a 4 or a 5, you may get $100 more, like $150. So if you imagine all of our doctors upcoding, even in the New York market, it makes a huge difference, and it just displaces the trust fund of all of our healthcare funds. I want to talk a little bit about unbundling. This is a type of fraud where they bill each step of a procedure as if it were a separate procedure. And I'll give you an example of this in the next slide. So if you do a common laboratory panel, I think one of the most common panels that is ordered by physicians is a basic metabolic panel. And for us, the CPT code is 80047. This panel includes 7 tests: calcium, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, and BUN. It's reimbursed as a bill, and it's $10. And if somebody unbundles it, that would mean they billed each of those studies separately. And we would pay much more if we had to reimburse them on a separate level. Medicare, which is our government, long ago developed the bundling so that we weren't paying for each of these studies when the test is actually done as a set with an automated report that's very easy to interpret. So we shouldn't be paying more than $10 for this, but if they unbundle it and bill each of those components separately, we would potentially be paying $60 to $70. So that's another issue that we're constantly watching out for. Next slide, Erin. Medically unnecessary services. This is a huge problem because the way that the U.S. Health system is set up right now, and Erin will get into this a little later, but some of our products are services. So the more services, the more fees. So what a lot of these physicians do is they decide, well, if I charge for more fees or for more services, I will get more fees. So they begin performing services that are not medically necessary just for the purpose of generating money from the insurance payments. And we're seeing this in all sorts of nerve conduction studies and other diagnostic testing schemes. So here's an example, and this is a real example. There was a cardiologist in Chicago that was recently sentenced to 12.5 years in prison, and he was ordered to pay $16.5 million in fines and restitution after he pled guilty to performing 750 medically unnecessary heart catheterizations, along with other unnecessary tests, unnecessary angioplasties. This happened over a 10-year period, and it included other physicians and hospital employees, and it resulted in the deaths of at least 2 patients. He was doing this out of greed to garner his revenue, to make more money. The physicians and the hospital staff induced hundreds of homeless persons, substance abusers, and elderly men and women to feign symptoms and be admitted to the hospital for cardiac risk. They offered them incentives such as food, cash, and cigarettes. There were 750 people who had needles stuck into their hearts purely for profit, not because they needed it, said one of the federal prosecutors. This was a very, very serious case. There's a lot of less invasive cardiac procedures now, but back in the day they were actually cracking the rib cage open to do a lot of the open heart surgery, which you all know is very invasive, very dangerous, very debilitating to the patient. And this was a huge quality of care issue along with a very egregious fraud case. Next slide, Erin, thanks. Misrepresentation of service. This is when physicians misrepresent a service that is not covered by insurance or by the government Medicare or Medicaid programs. They misrepresent it so they can get it covered. We see it in cosmetic surgery schemes, which I talked about a little earlier, where nose jobs are billed as deviated septum repairs. Next slide, please, Erin. An example of this is another dermatologist, one in Michigan, who was sentenced to 10.5 years in prison for defrauding multiple insurance companies of $2 million and endangering patients' lives. He actually performed multiple unnecessary surgeries to remove non-existent tumors from patients' faces, permanently scarring them unnecessarily. And there are additional charges pending in that case. Another type of fraud that we see is falsifying of the medical records. We see doctors that will falsify the patient's diagnosis records to justify the tests, the surgeries, or other procedures that are not medically necessary. I consider this one of the most egregious types of fraud, because if someone enters a false diagnosis into your medical record, which is a permanent legal record, they may be affecting your welfare for the rest of your life. They may affect your ability to be hired for a job. They may be affecting your life insurance. There's all sorts of downstream issues reading a false diagnosis. As we move to electronic medical records in the United States, there will come a time when the physicians in the emergency room will be totally reliant on your entire medical record that is available electronically. If someone has entered a false diagnosis into your record and that particular emergency room physician sees a false diagnosis and unwittingly treats you differently because of that diagnosis, your life could be at risk. So we consider this one of the most egregious types of fraud. An example is a Boston area psychiatrist was forfeited $1.3 million. He was sentenced to several years in prison following his conviction on counts of mail fraud, money laundering, and witness intimidation to his fraudulent billing of several health insurers for psychiatric therapy sessions that never took place. This is another example of false diagnosis placed in someone's medical record. He used the names and insurance information of people whom he had never met and never treated. He also went as far as to write fictitious longhand session notes to ensure a phony backup for his claims. In fabricating the claims, he also fabricated diagnoses for many of these patients, many of them adolescents, who now will have the burden of trying to get rid of false diagnoses in their medical record for the psychiatric diagnosis for the rest of their life. And one of the last type of fraud are kickbacks. These are the acceptance of gifts or money for patient referrals, or they can be a service of value. Next slide, please, Erin. So an example of a kickback is a laboratory that will provide a financial incentive to a doctor to refer all of his patients to their particular service. This happens quite a bit. Not only will they provide money, but they may do other types of incentives. They may go into the doctor's office and provide full-time laboratory technicians at no cost to the doctor to do all of their lab technical work. They might bring in free lunches every week. They may fly the doctor and his wife to South Africa for a conference, all expense paid, very luxurious first-class treatment. You name it. It's any goods or services in exchange for them using that particular lab. And then we come to identity theft. This is defined as when a person's name or other identifying information is used without that person's knowledge or consent to obtain medical services or goods or submit false insurance claims. Be the theft of a doctor or a patient's identity. Next slide, please. An example of this is a large hospital system employee was caught collecting medical identifications at the time of service, copying down the information of these patients and selling their identification for profit. He compromised over $10,000 medical identifications before he was caught. And on the street, you can sell a medical insurance number for somewhere between $50 and $200. So if you have 10,000 of these, it can be very lucrative for a criminal. And with that, I'll turn it over to Erin to talk about some of the laws.